Hi, my name is Pamela Coons, Associate Professor of Medicine in the Division of Oncology at Yale School of Medicine and Yale Cancer Center. I'm excited to announce ASCO's new open access journal, JCO Oncology Advances. As the inaugural editor-in-chief, I hope to support JCO Oncology Advances to become the premier platform to bridge the gap between accessible scientific research and clinical care. Stay tuned for more information, including new article types, at ascopubs.org/JCO Oncology Advances. We look forward to seeing your submissions in spring of 2024.
This JCO podcast provides observations and commentary on the JCO article, Provision and Discussion of Survivorship Care Plans with Cancer Survivors, results of a nationally representative survey of oncologists and primary care physicians by Danielle Blanch-Hartigan et al. My name is Winston Chung, and I'm a medical oncologist and a health services researcher at the British Columbia Cancer Agency in Vancouver, Canada. My specialty is gastrointestinal oncology, with a specific research interest in studying access and disparities in oncology care, as well as issues pertaining to cancer survivorship and end of life. The current article discusses the key findings from yet another analysis of the well-designed National Cancer Institute and American Cancer Society-sponsored Survey of Physician Attitudes Regarding the Care of Cancer Survivors, also known as SPARCS. In brief, this questionnaire was devised with the intent to characterize the perceptions, knowledge levels, coordination efforts, and practices of a large, nationally representative sample of U.S. primary care providers and oncologists, delving into their views with respect to key domains of post-treatment care of cancer survivors. Additional findings from other analysis of the survey have already been previously published in JCO and various high-impact journals. The present manuscript focuses on physician factors associated with the delivery and discussion of survivorship care plans, highlighting some of the current barriers to quality follow-up care and providing further insights into strategies that can help to circumvent these deficiencies in care. The concept of survivorship care plans has strong face and content validity. The Institute of Medicine report, From Cancer Patient to Cancer Survivor, Loss in Transition, recommends that all survivors completing primary treatment receive a survivorship care plan, including a written treatment summary and an individualized plan for ongoing follow-up from their cancer specialist. However, most of the research to date that explores the utility of survivorship care plans has mainly focused on patient-centered outcomes, such as their short-term satisfaction or knowledge levels. While these are certainly important parameters to consider, few studies have offered information about the factors that influence physician behaviors and their coordination of care for cancer survivors. One study conducted by Chung et al. And published in JCO in 2009 revealed that there were highly discordant expectations for cancer survivorship care, not only between patients and providers, but also between physicians themselves, underscoring the need for increased clarity during the survivorship process. In this interesting study, Blanch-Hartigan and her colleagues focused their analysis on three main outcomes. Specifically, number one, did oncologists provide written survivorship care plans to patients? Number two, did oncologists discuss follow-up recommendations and also outline the different providers' responsibilities for survivorship care to the patients? And number three, did primary care providers also do the same, in particular, discussing recommendations and delineating providers' responsibilities with the survivors? The research team also examined various clinical factors, including the physician's practice environment and their influence on outcomes. In the analysis, the study investigators found that only one-third of cancer specialists reported always or almost always talking about recommendations for survivorship care and explaining the different physician responsibilities for follow-up to patients. Even fewer actually offered written cancer survivorship care plans to patients. Likewise, only a minority of primary care providers reported performing any of these tasks. Not surprisingly, oncologists who had undergone specific training about the late and long-term effects of cancer were more likely to always or almost always give out survivorship care plans and discuss necessary follow-up recommendations, as well as providers' responsibilities with survivors, than oncologists who received some or no training at all. Conversely, primary care providers who reported inadequate knowledge or training to manage survivors' needs were less inclined to engage in survivorship-related tasks. Of note, the authors also showed that primary care providers who always or almost always received a treatment summary and follow-up care plan from survivors' oncologists were significantly more likely to have discussions about survivorship care with survivors than those primary care providers who did not always receive these documents. Many of the conclusions that can be drawn from this analysis are more confirmatory in nature rather than completely novel. The observation that cancer survivorship care plans are infrequently delivered to patients, or the finding that discussions about physician roles and follow-up is suboptimal, for example, has been previously described in the literature. However, there are some noteworthy results. The first distinguishing feature of the work conducted by Blanch-Hartigan et al. Is that it represents one of the very few studies to attempt to identify the socio-ecological factors associated with survivorship care patterns that may serve as specific target areas for intervention, namely physician training and care coordination. The observed association between increased physician training and higher quality cancer survivorship care, as evidenced by more discussions and greater use of care plans, is also noteworthy, albeit somewhat expected. As physicians become more familiar with late and long-term effects, they are also more inclined to engage in better care. This seems intuitive and highlights the need for increased awareness among physicians. A more interesting question that the study fails to answer is how best to provide survivorship education to physicians so that they are more comfortable with cancer survivorship. In the face of limited resources and increasing financial constraints in the healthcare system, I would propose that innovative approaches to enhancing education must be explored. This may entail the incorporation of mobile devices, tablets, or other technological advances to streamline the process of discussion and provision of survivorship care. Another important finding is the observed association between better care coordination and better survivorship care. Primary care providers who receive survivorship care plans from oncologists were almost 10 times more likely to participate in survivorship care planning, underscoring the significance of a collaborative relationship among physicians themselves. Emerging data suggests a growing interest in shared care models whereby both oncologists and primary care providers share responsibilities in looking after cancer survivors. Careful communication and deliberate coordination are essential to the success of a shared care model. This represents a key focus area of future intervention studies. Taken all together, the data from the study provide a useful benchmark to assess the utility of new models of care for cancer survivors. The obvious next step is to develop clinical trials to effectively test and validate the hypothesis that improved care coordination and enhanced physician survivorship training will increase the frequency of survivorship care discussions as well as optimize the use of care plans. I personally eagerly look forward to the results of these potential clinical trials. This concludes this JCO podcast. Thank you for listening.
For more original research, editorials, and review articles, please visit us online at jco.org. This production is copyrighted to the American Society of Clinical Oncology. Thank you for listening.